Okay, start. Today we are going to study about mediastinum. Okay, what is mediastinum? Mediastinum literally means middle septum. Okay, middle septum. So mediastinum is the median septum. Look, median, not medial. Okay, median septum in of thoracic cavity enclosed between left pleural sac and right pleural sac. Okay, so let me write it down. It is median septum of thoracic cavity enclosed between left and right what? Pleural sac, or limited by mediastinal pleura. So basically it's a structure. Let me show it to you. So as you can see, this is the left pleura or left lung enclosed within the pleura, or this is the right lung. Okay, and as you can see, this space, look at this space, this hollow space, this is mediastinum. Okay, you understand? This is mediastinum. So another note about mediastinum: it is not a rigid structure. The organs like the heart or the thymus, they are connected with the help of loose connective tissue. So these are not fixed. Okay, and as we move, this can also slightly move. They are loose connective tissue along with some fats. So the structure is not highly stable. Okay, and so let's study about the boundaries of mediastinum. First, let me show you the picture. So this is mediastinum. As you can see, if this is mediastinum, what is it? What is in its anterior? This is what? Sternum. Yes, sternum anteriorly. As you can see, at the superior position there is a cavity. What is this cavity called? This cavity is superior thoracic cavity. Superior thoracic cavity. What is posteriorly? Posteriorly, everyone knows there is vertebral column. And inferiorly, what is this muscle? Diaphragm. So superiorly this vertebral column, posteriorly this, sternum anteriorly, and diaphragm inferiorly. So we understand the boundaries of mediastinum, and now the contents of mediastinum. Boundaries: anteriorly sternum, posteriorly vertebral column, inferiorly diaphragm, superiorly superior thoracic thoracic aperture. Okay, then now the contents. So what is the main content of mediastinum? And the main content of mediastinum is the heart. Okay, that's we all know. There are some other organs like thymus. So let me write it down. So there are some vessels, the major vessels like the ascending aorta, the three branches of ascending aorta, the vena cava or main branches of the vena cava, superior vena cava. That everything is included within the contents of mediastinum. So let me write it down. Contents: number 1, heart. Okay. Number 2, that is thymus. Number 3, vessels, or rather major vessels of heart. Number 4, trachea. Number 5, esophagus. Everybody knows about esophagus, so let's move on. Number 6 is the thoracic duct. Number 7, that is another major thing, that are the nerves. There are some sympathetic nerve, there are vagus nerve, parasympathetic nerve, all of that. So everything also is included. Nerves. There are sympathetic, there are vagus. Also inferiorly there is diaphragm, so the phrenic nerve will also be there. Phrenic. Okay. And last thing, lymph nodes. That's easy. Okay, so we are done with the boundaries. What is mediastinum, boundaries of mediastinum, and contents of mediastinum. Now mediastinum, as you can see, it is a big space. It's a big space, so it is divided for our ease of organization into mainly two parts, that is superior mediastinum and inferior mediastinum. The inferior mediastinum is further divided with the help of pericardium, that is the layer of heart within the inferior mediastinum is divided into three parts, that is anterior, middle, and posterior mediastinum. Okay, so let me show it. And how is the superior and inferior mediastinum divided? It is divided with the help of transverse thoracic it is divided with the help of transverse thoracic plane. So what is this transverse thoracic plane? It is an imaginary plane that is between the sternal angle, and a horizontal plane that is between the sternal angle, line joining the sternal angle, and lower border of T4 vertebra. So what is this sternal angle, sir? The sternal angle is the angle or space or line between the manubrium of sternum and body of sternum. What is the value of sternal angle? Yes, it is 163 degree. Okay, remember this. So let me show it to you. So it is manubrium, it is body. So this line, as you can see, this line is this line, no, sorry, not this line. Around this line is the sternal angle. Okay, so let me show it to you at another direction. As you can see, this is somewhat at this line, and this body of is at this line. Okay, so if we draw like that, this angle is sternal angle. Okay, 163 degree, that is asked in some fibers. So this is obviously 17 degrees, and this angle might change due to respiration or some other causes, and this is that angle, and this is T1, T2, T3, T4. So this line is the, and this is the lower border of T4. Okay, so this line is the transverse thoracic plane. So this part, this whole part is superior mediastinum, and this whole part is inferior mediastinum. Okay, understood? So let's discuss about the boundaries of superior mediastinum and inferior mediastinum. Let me delete this. So that's easy. What are the boundaries of superior mediastinum? Anteriorly manubrium, I'm talking about superior mediastinum. Posteriorly vertebral column, that is T1 to T4. Okay, superiorly, what did I call it? Superior thoracic aperture. Inferiorly is this line. What is this line called again? Transverse thoracic plane. Okay, clear the boundaries of superior mediastinum. Now let's discuss about inferior mediastinum. Okay, inferior mediastinum. So boundaries of inferior mediastinum: anteriorly sternal body, posteriorly vertebral column T4 to T12. Okay, superiorly transverse thoracic plane, inferiorly diaphragm. Okay, inferior diaphragm. So now let's study in details about the superior mediastinum. Superior mediastinum. So we discussed the borders, that's done. Now the contents of superior mediastinum. Before that, I should show you there is an important landmark at the transverse thoracic plane that will help you to understand what are the contents of superior mediastinum and the inferior mediastinum. Let me show you the contents. Okay? Sorry, the landmark. This is heart, and the apex of heart lies at this plane. Okay, apex of heart lies as this plane, that is the transverse thoracic plane. So if the apex lies at this plane, there will surely be ascending aorta, the three branches of ascending aorta. Okay, and the common things that are the esophagus, and that is the trachea, that are the nerves, that will all be present. Okay, that's easy. That's also true for the inferior mediastinum, that will have common structure. Okay, So let me take notes of one by one the contents of superior mediastinum. First is the arteries. There are some arteries. Number one is the arch of aorta. Obviously, if the arch of aorta is there, if the base is at the apex of heart is at the transverse thoracic plane, the arch of aorta will remain at the superior mediastinum. So the three branches of arch of aorta, okay, that is the brachiocephalic branch, common carotid branch, that is left, okay? Remember, left common carotid branch and left subclavian artery, okay? This one. So total is 2, 3, 4. So total 4 arteries. Alright, yes, sorry. Total 4 arteries. Veins. Remember this thing, okay? Right and left brachiocephalic veins, okay? Number 2, that is the superior vena cava. Number 3, left superior intercostal vein, okay? Now there are nerves. There are basically 4 nerves. Number 1, there is phrenic nerve. Obviously it will be there to supply the diaphragm. Phrenic nerve. 2, vagus nerve. 2, for the heart, that decreases heart rate. Number 3, sympathetic nerve. Increases heart rate. And left recurrent laryngeal nerve for larynx, okay? Now lymphoids, that is nodes, thoracic duct and thymus, that helps in maturation of B and T lymphocyte. Thymus, we all know. There are some tubes, that is esophagus and trachea. Trachea helps in respiration, esophagus in GI system, and muscles. Muscles are also easy to remember. The sternohyoid, just below the sternohyoid there will be sternothyroid. We can see both of the muscles are attached with the manubrium of sternum, so these are easy to remember. Sternohyoid, sternothyroid, and one new muscle, 1, 2, 3, that is longus. Sorry, let me erase it. Coli, longus coli, that will not be there. So this part is done. Now let's talk about the inferior mediastinum. Inferior mediastinum is mainly divided into 3 parts, that is anterior, middle and posterior part. How is the 3 divided? This is divided with the help of pericardium. that is covering of heart. The part that is anterior to the heart is anterior pericardium, that is anterior mediastinum, sorry, the area that is within the pericardium or including the pericardium itself. So the whole heart area is medial mediastinum, and the area behind it is posterior mediastinum. Okay, so inferior mediastinum, anterior, medial, posterior. Okay. So before going to the anterior, posterior, middle mediastinum of the inferior mediastinum, let me show you the parts of superior mediastinum. So as you can see here, let me tell you first, this is the sternal angle, T1, T2, T3, T4, lower border of T4. So around this level will be the transverse thoracic plane. So this area will be superior mediastinum. Now see the contents. This is the arch of aorta, okay, brachiocephalic trunk, okay, brachiocephalic trunk, that is common carotid artery, and that is subclavian artery or left subclavian artery, right subclavian artery from the brachiocephalic trunk. Okay, now this is the trachea, and esophagus is not shown here, and the nerves are also not shown here. You can see that by yourself. So now let's discuss about the inferior mediastinum. Before that, see this picture. Okay, so this is the apex of heart, T4, and here is the sternal angle and transverse thoracic plane. Okay, so and this part, okay, this part is anterior mediastinum. Okay, this is mediastinum, and this part, this whole part is the medial, or sorry, the middle mediastinum, and this part is the posterior mediastinum. Okay, what? So what is the boundaries of anterior mediastinum? Anteriorly the body of sternum, okay, posteriorly what is that? Pericardium, okay. Two lateral sides are the mediastinal pleura, or right and left pleural sac, and inferiorly obviously the diaphragm. So boundaries. So let's discuss the structures of anterior mediastinum. Wait a second. Anterior mediastinum. So these are already discussed. Body of sternum anteriorly, pericardium enclosing the heart posteriorly, superiorly transverse thoracic plane, and inferiorly diaphragm, on its side mediastinal pleura. Okay. Contents: loose areolar tissue, it will always be there. Superior and inferior sternopericardial ligaments, that is stretching between sternum and pericardium. Okay, that's easy, you can remember. There are 3 or 4 lymph nodes, that's also numeric. Lower portion of thymus. Okay, I don't have the organ in picture, so I cannot show that. The mediastinal branches of internal thoracic artery, or the internal mammary artery. Okay, the mammary or the breast lies almost at this plane, so the mediastinal branches of internal thoracic mammary will be at this position. Now let's discuss about middle mediastinum. Okay, so what are the boundaries? Anteriorly the anterior mediastinum, posteriorly the posterior mediastinum, and by two sides are the same, the mediastinal pleura, inferiorly diaphragm, superiorly transthoracic plane. Okay, easy, same. Posterior also same for posterior mediastinum. It is posterior medius for posterior mediastinum, posteriorly vertebral column and the intervening disc of vertebral column, anteriorly the middle mediastinum, posteriorly I said posteriorly, superiorly the same transthoracic plane, and inferiorly diaphragm. So let's discuss about the contents here. Middle mediastinum has the most number of content. Okay, that's also the largest part. Also, medial mediastinum contents. First is the heart. We all know pericardium, the cover of heart. Okay, the arteries, ascending aorta, pulmonary trunk, pericardiophrenic. Oh, remember this. This is cardiophrenic artery. The cardio means the arteries that supply the heart itself, and phrenic means the arteries that supplies the diaphragm. Okay, veins, as we see discussed already, azygous veins and the pulmonary veins. Sorry, azygous veins and the pulmonary vein. Nerve, phrenic nerve. Okay, deep cardiac plexus. Okay, that supplies the heart and it supplies the diaphragm. Lymph nodes, tracheobronchial lymph nodes, easy, and use bifurcation of trachea that this actually happens at T5 level. Yes, T5 level, and right and left principal bronchi. Okay, bronchi also depends. So now discuss about the posterior mediastinum. We already discussed about the boundaries, pericardium, anteriorly pericardium contents. Okay, bifurcation of posteriorly, anteriorly, or there, yes, remember this thing. This is a tricky thing to remember, but you should not forget. Also, it's anteriorly, there is the trachea. The trachea lies between the middle and posterior mediastinum. Okay, so the let me show you. See the trachea. Okay, the trachea bifurcation will happen at T5 level, and this part is anterior mediastinum, this part is middle mediastinum, and this part is posterior mediastinum. So this trachea lies at the junction of middle and posterior mediastinum. Okay, this is the transverse section seen from above. Okay, so at this position, almost at this position, is the trachea. So discuss further. Also, there are pulmonary vessels that you have to remember. Posteriorly, the bodies of 8 thoracic vertebra that are T5 to T12. Okay, intervening intervertebral disc. Okay, superiorly transthoracic plane. Okay, inferiorly diaphragm, inside mediastinal pleura. Easy, same. Contents: esophagus. Okay, the esophagus also be at the same plane. You can see esophagus. Let me erase all this. See esophagus. This is the esophagus, the posterior side. Also, thoracic duct will be there. The longus colli muscle that is attached with the vertebra will also be there. Right sympathetic chain, left sympathetic chain. This will all be under the posterior area. Okay. Also, through this image, you can easily remember all the contents of anterior, middle, and posterior mediastinum. Okay. So, with this, remember the azygous vein, hemizygote, all these azygous veins. Okay, all this you have to remember this. Okay, vagus nerves, sympathetic nerves, lymph nodes, this all I have to remember. In the next session we will discuss the clinical attributes of mediastinum. Okay, done.